Hi all, I am Dr. Raja Krishnan from SNS College of Physiotherapy. I am an assistant professor and now we are going to see a DD-based learning video for which is best, the anatomy or the physiology for the physiotherapy course or a physiotherapist. These four students of my mentees and these four students of my mentees are going to discuss about anatomy and physiology which is best in their own perspective.
Okay. In essence of physiotherapy, where the patients mainly come to our clinic for the cause of pain. To assess the pain, we need to know the origin of pain. Which are the fibers which carry the anatomy? We need to know the fibers which carry the pain signals to the brain and the mechanism of injury. So we need to know the pain anatomy.
I don't agree with that, and we want to know about the pain pathway and how it travels, and what's the kind of activity which involves between the nerve fibers and which conducts the pain to the thalamus area and cortex region. This is the most important aspect to analyze the pain and the variation of the pain.
So, neuroanatomy. Neuroanatomy, about the blood supply and the nerve supply, neuroanatomy plays an important role in the human body.
I agree with that, but we want to know about the neuron track, which are called as ascending track and descending track, which take the pain from the muscles to the cerebellum, which gives the motor stimulation, which is carried out by descending track, which helps to move from that pain or change the action of the body.
A physiotherapist should know the anatomy so that a person can specify the area of pain, so we can know the muscle which is affected, a nerve, a joint. So anatomy is crucial for a physiotherapist.
Okay, but nutrients caused by muscles wasting and some other functions of body to know the physiotherapist to treat the patients. In cardiovascular system, anatomy of the heart is very important. We should know about where the blocks are formed in the heart. We should know about the veins passage, and we should know about the blood passages in the heart. During the surgery of the heart, we should know about where the blocks are located, and we should know about the areas of the heart.
Okay, I do agree with the anatomy part, but for the physiology part, you should know it is compulsory for a physiotherapist to know the physiology of the heart. So you can identify the disease, you can identify the complications of the heart, and you can do the treatment according to it. So I agree with the anatomy, but for the physiology part, it is very important for a physiotherapist to see the working of the heart, the pumping of the blood, and the way passages, where it works, how it works. So all this includes physiology. So it is very important for a physiotherapist to know the physiology of the heart too.
In case of joint injuries, we need to know the joint structures and the nerve supply and the blood supply to the joint, where it is due to the mechanism of injury or the wear and tear that occurs to the joint or any other kind of activities that leads to the injury of the joint.
Yes, I do agree, but you have to know the physiology because you cannot insist the joint or any part of the body suddenly, but you can aspire the joint or you can take a blood test and you can find out the cause of the disease or any injuries happen to the part of the body. You can identify easily by aspiring the liquid, fluid or blood. So this is important where you have to learn the physiology of each body part, each joint, each mechanism is very important for a physiotherapist to know physiology.
It is mostly based on the treatment protocol. For the assessment, we need to know more about the anatomy of the joint, where it is went for the wear and tear injury or wasting or some kind of which kind of disease that affects the joint.
Okay, when you go for assessment is okay, but you go for treatments, you should know the mechanism. So mechanism can give you the answer or it can solve the problem too.
Yeah, I do agree with it.
Yes, I do agree with those both teams, but we have to know that both anatomy and physiology should be learned by a physiotherapist, should be taught in the physiotherapy college because the anatomy part and the physiology part combinedly gives a patient proper assessment and also the treatment. Like we have to know the where the muscle originates, and also we have to know how the disease it's getting progressed. So in this case, we have to know the anatomy, and also the physiology to improvise ourselves and also for the patient's wellness. So with this, we can conclude that the anatomy and physiology are the two pillars of the physiotherapy throughout your life, not only for your subject and course these 4 years, 4.5 years, and also for your future and also for your patient's wellness. Thank you.